Good afternoon. It is Christmas Eve. Oh my goodness. And it is so wonderful to be able to welcome you to the Flint Community Webinar on Coronavirus. We are now in week 33, December 24, 2021. This
Wait, you said,
webinar,
hold up, Yvonne, you said week 33.
I said 33, I meant 93. You see where I am. All right, we're off to a great start this afternoon. I'm telling you, okay, technology challenges, we're going to acknowledge them. But week 93, and this webinar today is sponsored by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Prevention Research Center of Michigan. We are so excited that you've joined us. And now today, we know it is Christmas Eve. And as your moderator today, I want to thank those of you that are joining us from whatever venue. Some of you are on YouTube, some of you are joining us by Facebook, and those few of you that may be joining us in the webinar itself, we welcome you today. As a co-director of the Healthy Flint Research Coordinating Center, we look forward every week to bring this webinar to you with some amazing, amazing partners. For the last 93 weeks, we have had an array of community partners from our local health department, even to our state health department, the Department of Health and Human Services. And we mentioned once before that we even had the Michigan Public Health Institute. We've had a number of our partners come every week to answer any questions that you might have regarding the topics that we cover. One of the things we said to you early on is that this would be a webinar that would bring a local context to a global pandemic. And at the same time, we recognize there's a series of other issues that we continue to face in our community. So we tried to bring you updates on those as well. So today we're going to do no different. We're going to talk to you, but it's a little bit smaller group of us that are going to be talking to you today on this holiday eve. And so we're going to do a holiday check-in. We want you to be mindful and be well. So we're going to give you some more ideas about what that could look like. And then we're going to have a discussion about Omicron, the science and the reality. We'll have a medical moment to you, and then we'll bring you up to speed again on the mask mandate, some of the things that have we've been encouraging for these universal precautions and why this is so important. So today we're going to get started right away. I'm going to ask our great team here. We see Dr. Deborah Holden, Dr. EJ, we affectionately call her Dr. EJ, Dr. Jennifer Edwards Johnson. We also have Dr. Reynolds here with us, and we have Susan Wolford, Dr. Susan Wolford. Jim Melanowski has joined us today too from the Genesee Health Plan. So we're going to ask you all to just join us in this conversation this afternoon. Let's get started. It's holiday time. And thank you, Jim, for wearing that wonderful holiday sweater just to keep us in mind that it is holiday.
Woo-hoo.
And Jim, before we get started, we're talking about updates and holiday check-ins. The Genesee Health Plan has been available for community members for now 20 plus years. There's some things going on. We're still in open enrollment period. So just as we get started today, one of the questions always comes up is, what if I don't have health coverage? In the midst of all that's going on, how would you help people understand what's available?
Well, again, yeah, you're exactly right. Until January 15th, there's open enrollment into the Affordable Care Act, Obamacare, the marketplace. There's a lot of names out there, and sometimes that's confusing. But yeah, so if you're at the holiday table today, or you're interacting with family and friends, and someone says to you, "Yeah, I don't have any health insurance," or "I just lost my job and they don't offer me, insurance," or "I'm looking for something," please contact the Genesee Health Plan, and we can help find some healthcare coverage, whether it's on the Genesee Health Plan itself or Medicaid or a number of different areas that we can help with somebody. So that's probably the best thing I can encourage, is just be a good listener out there, and then really encourage people to get coverage, because you just never know. And it's good to have that in your back pocket, just like you have car insurance, just like any other type of insurance. It's just good to have in case something happens. And then the other word I have, it's hard to do preventative services in these last couple of weeks, as we all have fun eating and so forth. But really, we did talk about New Year's resolutions after January 1, but one of them should be to establish a primary care home, see a doctor on a regular basis, so that when a pandemic happens, or you're debating whether you should get a COVID shot, you have someone that you've established a relationship with that you can talk to and really get your questions answered by them.
Now, Dr. EJ, I see you nodding your head when you talk about that healthcare coverage, being able to get to that primary care physician. What do you say to our listeners today?
I say Jim's my best friend. No, no, I mean, no, I completely agree. Get in with your primary care physician, get those questions you might have answered. They should be your trusted messenger in this journey. So absolutely agree.
Thank you. So as we do this holiday check-in, let's get started on talking a little bit more about how to prepare for the holiday. And I know this is one of Dr. Reynolds, he's really keen on saying what we need to do. And Dr. Deborah, you've told us about these layers of protection that we need to take. So let's check in. Today is Christmas Eve. Families have already started to gather together. So what are some of those tips that you want to give us to continue to think about? Dr. Reynolds.
Well, it may be too late, but if your prescription has run out, contact your pharmacy. Sometimes they'll give you 2 or 3 days supplies, or better yet, contact your physician. And hopefully their office is still open. Otherwise, you have to wait until Monday. So if you're on any medications, make sure you have a sufficient supply. That's most important. Next week, between Christmas and New Year, you can update your vaccine. If you haven't had your flu shot, that's great. And if you went to somebody's house and you saw all these people you don't know, and people weren't wearing masks, you don't know their vaccination status, even if you know them, you see that they didn't crack the window, you see that they didn't set their heating system on, which runs constantly and constantly exchanges the air, as opposed to automatic, which only comes on when the temperature drops. Keep it on so you have that constant air exchange. And if grandma or your family members will allow you, crack that window a bit by your door. Mm-hmm.
Dr. Reynolds, you said something I don't think we've talked about before, even in the...
I learned it last night.
Okay. So that's really good, because one of the questions that came up to me, and I didn't know, some people have enclosed spaces where they don't have like a ventilator, but you're saying, did I say the right thing? A vent, not a ventilator, but a good venting system.
If you have forced air heat,
they can just keep their heat on, not automatic, but just on, and let it run.
There's a setting called on that will show up on most modern thermostats. And that means the furnace fan will be blowing constantly. And if you have a good filter, and that's another thing, change your heater air filter, that will also help. And if your guests can stand it, crack your window, and maybe you want to limit the length of your celebration. And you should definitely limit the number of people who come in. And, I'm real picky. I'm not letting anybody in I don't know. And I'm not letting anybody in who doesn't have a vaccination card to show me. And as I've said before, that includes my kids, my grown kids. Now, by the door, keep some masks, keep some hand cleaner. Also have a guest log so people can sign their name, who they came with, and their telephone number and address. So if there's a problem, someone turns positive, they can be contacted, okay? Or if someone gets symptoms the next day. The other thing to be a good guest is you should have been tested yesterday. Maybe you can try to get tested today, or at least the day before you show up at somebody's house, and at best the day before and the next day. If you have symptoms, headache, runny nose, cough, congestion, fever, chest pain, trouble breathing, you really need to get tested. And I'll let the grown-up doctors handle the rest of that, the danger signs. But if you're sick, you don't need to come to somebody's house. And if you're real sick, you need to talk to your doctor. Okay, as far as food service goes, I say the food server should wear a mask. Now, people tell me that's overkill. I say the food server should wash their hands and wear gloves. I've been told that's overkill, but you can at least wash your hands. You should have different tables for different households, or set up some TV tables just so that you can maintain that physical distancing. And notice I didn't say social distancing, because if you're in the room, if you're in the house, you're socializing. And then most importantly, remember there are people with special situations. And see, this is one we didn't emphasize enough. If you have a guest who is pregnant, or someone in the household who is pregnant, you should really be careful about maintaining your physical distancing, wearing your mask, and who comes in the house. The same thing applies for elderly people. I've told you before, I have a 93-year-old mother. I get tested before I go visit her. And if I'm going to make another stop, I make those stops after I visit my mother, just to limit their exposure, and especially with the variant. And I'll turn that over to the other speakers. So if someone's on cancer treatment, if someone has an immune compromised system, you should also be very careful about how you do this. And I'll repeat myself, vaccination is the foundation of prevention of infection. But then we have those other layers that I touched on, and I'm sure Dr. Furholden and others will review them again. So I'm done. Love you all. Thank you. Merry Christmas. Happy New Year. And remember, act your age and not your shoe size.
Okay, Dr. Jennifer, I'm going to ask you, Dr. Reynolds said he's going to leave some of this to the adult doctor. So I'm going to, is what he's saying a little bit overkill, or does this make sense?
All of that makes sense. I don't think any of that is overkill. I think everything he said is prudent and something we need to be practicing. I think particularly you have to think about who's in your household. Are there kids who can't get vaccinated yet? Are there pregnant people in your household? Are there elderly people in your household that you really need to protect and make sure that you're being that layer of protection for them? I think the idea, he mentioned testing, right? And I think there's a lot of questions about how to test and what testing means. And I really appreciate that he kind of talked about how he tests, right? I think when we think about testing, we hear about so many different ways of getting tested, right? You can get a rapid test or a PCR test. And I think we have to step back a little bit and think about what that means. So when we think about a rapid test, those are usually the tests that come back in about 10 to 15 minutes, right? They might be those tests that you have at home that seem really similar to a pregnancy test. If you've ever seen one, there's usually a little control line and a line that says whether you're positive. Most of them have a little swab that you swab your nose with. You put in the little kit and it gives you a result in about 10 to 15 minutes. Those are really useful if you have symptoms, right? So if you have, runny nose, you're starting to feel a little bit ill, those tests are best when you have some symptoms, because they really tend to only detect whether you're positive if you have a certain amount of virus, if you're sick enough for it to be able to pick it up. They're not as great at picking up when you're asymptomatic or really early. So if you're going to visit people, it's really important, particularly if you don't have symptoms, to think about getting a PCR test, right? And those are those tests that sometimes might take a little bit longer to get, right? You might go to Myers doing some of them, your local stores, your local health agencies are often doing PCR tests. And why those tests are a little bit better is they take material and they multiply it. So they can detect really small bits of virus, right? So even if you haven't become symptomatic yet, those PCR tests are looking for the smallest amount of virus and will tell us before you get sick whether you have the virus, and are much better at telling us whether you might be safe to go somewhere or not. In the event that you only have, what's called the antigen test, or that test I described first, that usually gives you a result in about 10 to 15 minutes, you should, as Dr. Reynolds mentioned, you should be testing day before, day of, day after, to make sure that, in the event that you do have the virus, and in the event that you aren't able to get a PCR test, that you're giving the test an opportunity to detect any virus that you might have. So you might need to check a couple of times just to make sure that, I checked the day before, I checked the next day, that gives your body time to make more virus, and for that test that's not as great to pick it up.
Well, that's really interesting, Dr. EJ, and I'm so glad you shared that, because we have local testing sites, and we've talked about them every week. And one of the things that sometimes people don't know is that those local sites, they can get both tests at the same time. They can get the rapid test that'll know right away, and then they can get the PCR test. But it's really important for us to know all you have to do is ask, and they will gladly provide both those tests for you in that setting. Now, Dr. Deborah, you're an epidemiologist, and you've made it very clear there. You're not the medical doctor, but you're the epi doctor. So how does this shape out in your world, and help us make sense of it?
But what I love is I'm the epidemiologist who has always lived, worked, played, and worshiped in one community. So I live, work, play, worship all right here in Flint. So I utilize the very same services that I'm encouraging people to utilize. And I'll tell you, one of the things that I just really hit home for me is the fact that we have such a robust, barrier-free, readily available system for testing and vaccination. And I did not realize quite how unparalleled it was. I had a colleague and a friend in Baltimore who thought she had COVID and wanted to get a rapid test because she had an exposure. Her employer wouldn't even let her come to work. She works at a university. She's a head chef. I said, you can't be here. You can't be on campus. You can't be preparing food. Like Dr. Reynolds says. So for the university, it is not even a question. All the staff are masked. They do not want spray on the food that's going to the students, right? So why would you want spray on the food going to grandma and auntie and your cousins and your family? So that's a great idea. But so I had the hardest time finding a test where she could get a rapid test. So I want to make this super duper clear for people. Dr. EJ said it, and I want to underscore one thing, because now my entire family has been COVID positive, and my son gave me permission to share. My son is now COVID positive. He was exposed on Friday at an event. He found out on Monday that, and this was in Maryland, he was in Baltimore when he was exposed. He found out on Monday that the person he had been shoulder to shoulder with for much of the event tested positive. He took a rapid test on Monday. It came back negative. He started to have symptoms on Monday. On Tuesday, he had more symptoms. He took a rapid test and it came back negative. And I said to him, when he went on Tuesday, I said, the benefit of the great community testing that we have in Genesee County, you can get a rapid test and a PCR test at the same time. Our testing protocol is, if you tell them that you have a known exposure or symptoms, they will give you both. Yeah. You don't even have to ask. If you just endorse that you have a known exposure or symptom, they will give you both. He didn't say he had a known exposure because he was afraid they would say, well, you can't be here if you might have COVID, which is not how it works, right? So I just want people to know that, because the point that Dr. EJ made is great. These rapid antigen tests are actually really, really good. We just need to understand what their limitations are, right? So the limitations are, they're very good at detecting people once they've got a sufficient viral load. If you look at the metrics for the test, how good is the test at identifying true positives or correctly identifying somebody who doesn't have COVID as a true negative? They're very good, but their sweet spot is sometime of right around about 4 days after you've been exposed. So if you're getting that rapid test earlier than that, the test still has some ability to identify you, but it has less ability. It has more ability around day 4. The problem is, in those days in between, it's possible that you might have enough viral load that you could shed virus and infect others, but not enough to come up positive on the test. So if you're listening and you're in Genesee County, take advantage, get both. Get the rapid test and get the PCR test. And if you have any symptoms or known exposure, just treat it act as if you have COVID, and wait until you get that test result back, that PCR test. If your antigen test is negative, just wait the 2 or 3 days before you get that PCR test back. Stay in quarantine so you won't infect anybody else. The gift that you don't want to give to your loved ones this season is COVID. That is it. I'm like, you can keep that. And there are things other than, I don't want your COVID. I don't want your cold. Because people are like, oh, it's not COVID. It's just a cold. I don't want that either.
Such a good point. I mean, this idea that you have symptoms and you'll test for COVID so you can decide whether you go somewhere. I think we need to change the narrative around having symptoms and going anywhere, right? Like, if you have cold symptoms, you should probably be staying away from people. Certainly there's currently a bigger risk to COVID, but you don't know the people that you'll be interacting with. And a cold can be very dangerous for someone who's pregnant or who has a pre-existing condition, et cetera. So generally we should be thinking, if you have symptoms, maybe wait it out until you're starting to feel better. Feel free to COVID. In Genesee, we are certainly lucky because we have access to PCR testing and rigorous testing. But if for some reason you don't think you have access to it and you might only have a rapid test, wait until you're really starting to, you notice you've had symptoms. That 4-day mark is really good. We were going to talk a little bit about Omicron variant. One of the things I've heard a lot is this question about whether tests are working for Omicron variant. We're seeing great data that they work, but similar to every other variant, right? It's that sweet spot, 4 days, right, after an exposure, or even, a couple days after symptoms. Remember, our rapid tests work when there's a certain level of viral load, right? And usually that viral load is consistent with your symptoms. So you had symptoms a couple days, right? Usually by then is when you can be a little bit more confident that you're going to test positive. But I would really encourage people to follow up negative rapid test results, particularly in the presence of symptoms, with a PCR test, particularly if you have to leave. Go ahead, I'm sorry.
So Dr. EJ, just while you're right there, and you said viral load, and I know we've talked about this before, but can you just tease that out a little bit more for us so we're really clear when you say viral load?
Absolutely. So the virus works by sort of infecting you and making multiple copies of itself, right? The more copies it makes, the more it stays around in your body, usually the sicker you get, right? And so viral load, you could maybe only have 2 or 3 particles. It's really early. You've just been infected. You're just, this is sort of what we talk about our asymptomatic people, right? They might have a low viral load because they don't have much virus in their body, right? And certainly sometimes those people will get a rapid test and they will be negative. What our PCR test can do is it duplicates everything it sees, right? It takes a sample and then it multiplies everything. So it can detect whether you had any virus in your system at all. A rapid test can't do that. It just detects what you have at that time. Mm-hmm. A few days later, the virus keeps multiplying every day, every hour, right? It just keeps multiplying. So if you test a little later, you usually will have more virus in your system, which is why the rapid test can be a little bit better later on. So they detect higher viral loads.
Thank you, Dr. EJ. I was thinking, because I've had both vaccines and then I got my booster, and sometimes I'm wondering, I feel like I've got a head cold, my eyes are running. I don't know if it's a head cold, if it's allergy. And I asked the doctor about this. And so I got a little bit nervous last week because I went to buy some Christmas gifts and I'm very sensitive to smell. So I go in Bath and Body Works and I couldn't smell anything. I was like, oh my gosh. So I waited a couple of days and I went to get the test because I'm thinking, I don't like this. It just created this extra level of concern. Fortunately, the test came back negative, but I got both of them. And so again, to what you're saying, we have other things going on. I have this allergy head cold, and it's mimicking some of the same things that we're hearing about the virus. So I'm glad we're talking about continuing to get those tests because we need to be sure, because I was concerned about whether or not I should, still have my children come. Everybody's vaccinated, everybody gets tested before they come, but it's still that worry because Omicron thing, we just don't know enough about it yet.
I think I see this in my office. I was in the office yesterday seeing patients before the holiday and refilling prescriptions for people like Dr. Reynolds mentioned. And I saw a lot of this, right? I have a sinus infection every year around Christmas, right? But I need to make sure it's a sinus infection because I'm going to have my friends and family over, and doc, I just want to get tested. I know this is my usual sinus infection symptoms. These are my usual sinus infection symptoms, and I just want to be sure. And I think that's important. I think once you've had symptoms, right, you develop those symptoms and it's been within, you've had these symptoms for a couple of weeks, you get your test and then you know that those are what your symptoms, that's what's causing your symptoms, but get the test and make sure.
Thank you. Now I see Dr. Paul Kilgore has joined us, and we're going to talk about the Omicron, the science and reality. I want everybody to stay here, please. Don't go away. But Dr. Kilgore, when I talked about this not knowing a lot about this Omicron, you immediately said, let me say something.
Thank you very much, Yvonne. It's great to see everyone. And actually, I've been listening all the way from Dr. Reynolds through, and everything that you've heard is actually right on. It's perfect. And I agree 100% with what everyone said. I think there's a couple of things to add to the discussion, which is interesting. One is that today, in the wintertime, and I just checked my humidity in my house, it's about 38% relative humidity indoors, which is pretty low. And of course, our humidity indoors goes down in the wintertime. So one of the things that we know about viral pathogens in general is that they travel much better on both droplets and other particles in the air when the humidity is lower. So this is a really important idea, because if you can raise up the humidity inside your home, in addition to doing all the things that Dr. Reynolds talked about, like changing filters and stuff, then you have a better atmosphere indoors. You likely will breathe better. So specifically for you, Yvonne, but others too, and I'm thinking about this too, you can get a room humidifier and raise the humidity in your location. So that's just one thing to think about. All the other things that Dr. Reynolds mentioned in terms of asking your guests if they've been vaccinated, I think is great. There's new guidance out as well about the masks. And I think one of the things that we know about Omicron is that it has I'll call it a transmissibility factor. In math, it's called an R naught, but the transmissibility factor of the new Omicron strain is much higher than both the original Wuhan strain and the Delta strain and all the others that went before it. What does that mean in practical terms? It means that the virus can move from one person to another much more efficiently. And the reason it can do that is that it's figured out a way to modify itself and be able to bind better to the ACE2 receptor that is on the surface of cells in your nose, in your throat, your upper lungs, and your lungs, and many other parts of your body. So when we talk about protecting yourself, now I think we need to look at everyone upping their game in terms of type of mask that they use. I do not recommend a cloth mask. If you can get an N95 or KN95 mask, that's what I would recommend using. And when you wear it, one of the things we want to do is make sure you have a good seal at the top of your nose here, up across the bridge of your nose, and then down around your cheeks, and then around the edge of your jaw and down here. So you want that good seal, because any leakage means that you will have the opportunity to bring in virus from the side or the top. The surgical masks are okay, as long as they're at least 3-ply. That's okay. If you're going to wear a surgical mask, one thing you can do is double up on them. And so the cloth mask is really the cloth surface mask that you see, like you might get it as a gift or you see in the stores, probably will not protect you the way we need to against Omicron. You can combine a surgical mask with a cloth mask. That's another thing you can do, because we want to really make a very good barrier when we're talking about going out in public. And, I was just earlier out, and one of the things that I observed is the low mask usage. What I would like to see the governor and other people in Michigan do as far as leadership is really to say to people, wear your mask anytime you're out in public, anytime you're out shopping, in a store, at a restaurant, anytime you're out in a venue where you know you can't social distance. And that way we're going to reduce the spread of the virus for sure. Okay. And I have one more thing I wanted to show you, Yvonne, but let me stop there, see if you have a question.
Yeah, yeah. If you could, I want to get some more reaction from the panel, and then we're going to come back to you so you can show us that information. So now, Dr. Deborah went and got something spraying behind her. Look at this. All right, tell us about
Dr.
it. I know that
Kilgore
was
said it the best, and I will tell you, my great colleague, Dr. Shanina Knighton, is an infection preventionist, and she told me the exact same thing that Dr. Kilgore said. And I have this wonderful humidifier that actually was in my granddaughter's nursery. And when we contracted COVID, we were trying to do this with air quality in our house. I ordered this online. I won't name the company because I'm not doing promotions for them, but I ordered this online. It literally came the same day. If you live in Flint, you can order one of these and it will come the same day. And we ordered 3 and it will run continuously for 10 hours. Totally changed the air quality. Also made it a lot easier to breathe. Also, so I just tip my hat to Dr. Kilgore. And Yvonne, you know I've been advocating for these because people don't like to wear the mask. It's so bizarre. I literally talked to a colleague who's been in Spain for the last month, and they have about a 90% vaccination rate. And she said, everybody there is vaccinated. When they go indoors, they just put their mask on and it's like no big deal. You know, people keep saying, when is this going to end? I'm tired of it. It will end when we effectively integrate and do the things that we know to do to mitigate spread. And so, because in fact, it looks like we are going to need these KN95 or N95 masks. And I just remind people, again, I ordered these online too, and I got them in all colors. So if you don't like the way it looks, you don't like the way it feels, you can order them online. It costs just a pinch more than the also working with Mayor Neely to do a big push to get these masks widely distributed in community.
Thank you, Dr. Reynolds. Everybody's got him stirred all up.
Yes. Some people may ask the question, who is Dr. Kilgore? And he's so modest, he won't tell you.
He's coming. Thank you, Dr.
He
Reynolds.
has worked with us since the Flint water crisis. He was on the team that identified issues of Legionella in the water. So he's an honorary Flintstone along with Dr. Walford. So please listen to what he's saying. And he's an infectious disease specialist.
Yeah, and that he's going to show us some good stuff in a minute, Dr. Reynolds. And we asked him specifically to come because you and I have talked a lot. And you said we need somebody who has that infectious disease background. And so Dr. Kilgore was so gracious to come and be with us. So I want to get a couple more comments from our panel. Dr. Wolford, I know you've got some things to share about the pediatric side of all of this conversation, and then you're going to give us a medical moment in a little bit. But what about the ped side of all this? Dr. Deborah shared about the little one in her household, the extra precautions that they made, and some of we still know all of them can't get vaccinated.
Right, but you know what? At least some of them can. So this season, I'm all about hope, because this time last year, very few of us had access to vaccines. N95 and KN95 masks were much harder to come by. We didn't have the knowledge that we have now. But this year, we have those things, right? So we can vaccinate down to age 5. So if you have a 5 to 11-year-old, you can protect them this year. That's a gift you can give them that you couldn't have given them last year. And so I want to say that's a reason for hope. Also, of course, if you have your 12 to 16-year-old, and they also can get the vaccine. So we are able to vaccinate the large amount of youth. And so we could break the cycle here, and we can do something in pediatrics that we couldn't do before. Now, of course, you do mention that there are the younger ones under 5 that we can't. And I guess my little hope has to go down a little bit, because the studies that were being done in order to see if we could give it to the 2 to 5-year-olds, those have not gone as fast as we'd hoped. The dosing isn't quite right, and so they have to work a little bit more on that. So while we have this period where those younger ones can't be vaccinated, then we have to do all those things we've now learned to do over the time so that we can protect them. And there is some suggestion that, at least in South Africa, Omicron seemed to be affecting younger children more. So we really want to put all of those things into place. I have my flowers here because they're bulbs and bright. I was wearing black, it wasn't seeming very bright. The bulbs, and they're bright and bulbs, they look like they're dead, but then they bring hope and new life. We're at a point where we have hope that we'll come out of this, we will be able to make it, but only if we do all those things that we've heard on this line, so we can protect ourselves and the young and the very old who are so susceptible.
Thank you, Dr. Wolford. Dr. EJ, I want to give you the last word in this roundtable, and then we're going to move on. But I just want to hear you just give us some more good advice before we have to take off for the other part of this webinar, and what's going to be happening for the rest of, we got a week and our holiday coming up. So give us that advice.
I think my colleagues gave excellent advice. Wear your mask. I really appreciate Dr. Kilgore talking about the need to upgrade your mask, right? I would, and I agree with his point, I would start with wearing a mask. My daughter, every time we go to Target, she's 6, and she'll say, why are none of these people wearing masks? Because we've observed the same thing Dr. Kilgore mentioned. We got to get people wearing masks, right? That's one of the layers of protection, and we've got to get people wearing masks. Certainly upgrading that mask to that KN95 or N95 with a great seal. In your areas, a HEPA air filter, a humidifier, clean the air, make sure your air environment and air quality is as top-notch as it can be. Give yourself all of the layers of protection you can. Go into those holiday settings as protected as you can be, ensuring that everyone who can be is vaccinated and boosted, has taken a test, is not having symptoms. I have colleagues who are testing at the door if you can. Do as much of that testing and prevention that you can. Re-highlight what Dr. Reynolds said. Make sure you have a list of people who are coming so that you can notify them if someone develops symptoms. Be as on top of it as you can. I agree with Dr. Wolford. We're in a place where we have an opportunity for hope, right? We are much more armed with advice and intellect and opportunity than we were a year ago. We have the opportunity to mask. We have the opportunity to be vaccinated. The last thing I'll say is I'm not sure how much the public is aware of what's happening in hospitals. I have seen and heard of patients calling 911 for COVID symptoms and being told hospitals are full, right? Like, we can come, but we can't take you to a hospital. There's no space. I have seen hospitals that have no space and have 24-hour wait times. I have seen people in hospitals wait and have severe symptoms and just not be able to, have trouble getting care because we're full. Every hospital, this is not one hospital, this is every hospital in Michigan is full. So I think you have to consider that and be really thoughtful about what your exposures are, how you can limit exposures, how you can stay safe during the day, and think about what the healthcare system is doing and the risks that it presents to all of us who might need care, not just for COVID, but for something else.
Thank you, Dr. EJ, and thank you to this wonderful panel. I just want to remind us, Dr. Deborah mentioned how wonderful it is we have access to testing and vaccines in this community. I just want to remind you, even though the Genesee County Health Department is not available during the holiday weekend for those vaccine sites, as we were doing them every week, you can call the health department to get an appointment. For those of you that want to get tested, they're not testing at our community sites at the churches over the weekend because of the holiday, but Monday through Thursday of next week, they will be open and available. You can get both the vaccine and the testing done if you choose to do so. So those sites are available. During the weekend, Walgreens and Rite Aid, as I understand it, will still be available if you need to get those tests. I had someone call me this morning, and of course, they didn't know it, but were exposed, and now they want to be sure that they get tested. So please utilize these opportunities that we have that some communities don't have. And again, one more reminder, this week, the health department will not be open in those community settings for the clinics, but you can call the Burton Clinic, the Burton Health Department, Monday through Wednesday of next week if you need to get in there and get tested, but you must make an appointment. So we did ask Dr. Kilgore to come and be with us. And Dr. Kilgore, thank you again. He's the co-leader of the Wayne State University Flint Area Community Health and Environment Partnership, created to evaluate the effects of the changes of Flint's water system, as Dr. Reynolds has mentioned. But he is an infectious disease doctor. He's worked on some of the tests, even for Pfizer. So Dr. Kilgore, you said you had something really important you wanted to share with us in addition to what you've already shared. So we're going to turn it over to you right now.
Thank you very much, Yvonne. I'm going to be as brief as possible so we can try to answer some questions too. One of the things I want to mention is one of the reasons I was late today is that this morning, literally, I was talking with a friend of ours who has been exposed, and she was very symptomatic at home. In fact, when I talked with her on the phone, I had to call her twice because she had trouble picking up the phone. One of the reasons she couldn't pick up the phone is that she couldn't get out of bed. She couldn't get out of bed because she had severe muscle aches and body pain. She also had a lot of upper respiratory tract signs and symptoms. She had gotten a COVID test yesterday. The result was done, or the test was done at Beaumont Hospital. When she called to get the results, the person on the line said, our machine went down. So the machine broke and they had to fix it. So the test result reporting was delayed. So as I was talking with her, the other thing that came up was that she said, well, you know, I don't have health insurance. And I said, well, look, here's what I recommend. First, and she had, by the way, she had a dose of Moderna 1 week ago, her first dose. She hadn't gotten any previous doses. So she had her first dose a week ago, which is very good. So with the symptoms that she had in the clinical picture that we saw, one of the things that I said to her is, you know, it's Christmas Eve, I know. The hospitals are likely crowded, but getting in to see a doctor is going to be all but impossible at a private clinic or even an urgent care. So I said, go to Beaumont's emergency room. Go there now, and they will take care of you. They cannot turn you away if you do not have health insurance. I just want to make that clear so everyone can communicate that out to everyone that they know. If you have COVID symptoms, tested or not, and you are really to the point where you're uncomfortable, you're having upper respiratory tract symptoms like sore throat or cough or difficulty breathing, loss of taste and smell, even other symptoms that I'll show you in just a minute, and they're not going away, even it's getting worse, please get in to a doctor. If you can get into a clinic, call the doctor's clinic. If you can't reach a doctor's clinic, just go to the emergency room. And the reason is very simple. I had another friend of mine down in Houston, Texas, who went into the hospital and he went in too late, basically, and he passed away from COVID-19. A smart guy, hadn't been vaccinated though, and he went downhill very fast. One of the things about this disease is it's unpredictable. Depending on your medical condition beforehand, you could really decline very rapidly. That's one of the reasons why I told my friend this morning, please just go in, they'll check you out. If you're good to go home, they're not going to keep you. Trust me, they're not going to keep you. They're going to send you home. So don't worry about that. The other thing too that people need to know is that many hospitals do have the monoclonal antibody. Have you talked about that before here, Yvonne?
Yes.
Okay, so I just want to point out the monoclonal antibody is an injection. It goes in pretty quickly. It is a treatment for COVID-19 that is available in almost every hospital now. The new pills, the new drugs that you hear about, the Merck and the Pfizer that have been approved, the distribution really hasn't gone out yet. They're still ironing out the logistics on that. I talked with a friend of mine at Michigan Pharmacists Association just a few days ago. They're working on the logistics of how you can go into a pharmacy and not have to have a doctor's prescription. But right now, you probably will need a doctor's prescription, at least as far as I know right now. Meyer Pharmacy, just take note of that. Meyer Pharmacy is going to be one pharmacy where the Pfizer drug is likely to be rolled out first in Michigan. I'm not sure about CVS, Walgreens, Rite Aid, and the others, but for the most part, think about where your Meyer Pharmacy is, okay? Now, Yvonne, could I share a few slides really quickly? I won't take much time, I promise.
Sure.
Okay.
Yeah.
Okay. See if I can find. Let's see. So, has everyone heard about what's happening with influenza now in Michigan, in the United States?
Well,
you talked about that at all?
there's some information. We haven't gone into any depth. Just that you know, it is on the rise here too. So whatever you will share with us will be helpful.
Okay, let me get this going here. I think you see a bunch of books, don't you?
Yes. Yes.
Do you see any slides now?
Yes.
Okay. Do you see compare Omicron?
Mm-hmm.
Beautiful.
Yeah. It's not showing in presentation mode, but we do see it.
Okay. Let me. Well, without delay, let me just point out that there is a study that's been going on in the United Kingdom because they had introduction of the Omicron virus pretty quickly a couple weeks ago, and it just went up exponentially. And one of the things that they did is actually started a study to analyze data to look at the difference in symptoms between COVID-19 caused by Omicron and other COVID-19 illness, as well as other diseases. Can you see this graphic now?
Yes.
Okay. So let me see if there's got to be a way I can. Let's see.
If you go to slideshow.
How about that? Okay. Can you see
Yes,
the
that's it. Perfect. Yes.
Great. So one of the things I wanted to point out is actually the comparison I made, and these are the UK Omicron data in blue here. So these are the symptoms that we see with Omicron. And you probably heard the news that it tends to be, or looks to be, more mild illness right now. So people end up having sneezing, runny nose, headache, fatigue, and sore throat. These are some of the main symptoms that we see with Omicron. What does that sound like? It sounds like kind of a common cold, doesn't it?
Yeah.
Or flu. So then I went to CDC and I pulled down the CDC influenza signs and symptoms. And these are known to every doctor, but I want everyone in the community to know too. Runny nose, headache, fatigue, sore throat, also cough, fever, muscle and body aches, vomiting, and diarrhea. So these other ones here, we did see with COVID-19 before, which I think probably people know. Cough and fever were common with the original Wuhan strain and also the Delta and some other strains. Not so much with Omicron so far, but also realize these signs and symptoms can vary. So from a doctor's perspective, and even from your perspective, when you compare these two, you can see the overlap in the red, the overlapping signs and symptoms here. So you can immediately see how when you present to a doctor, one of the things that you need to have in the back of your mind is, if I get tested for COVID, particularly with the PCR test, I like the PCR test because it's more sensitive. It's a more specific test too. If that test is negative, then the very next thing that I want you to think about and get is a flu test, influenza test. The reason is that we're seeing a dramatic rise in influenza circulating across the United States. Right now, among everyone tested, it's about 3.5% test positivity. That's at the national level. So the other key message for today is not only do you want to get COVID-19 test and flu test, but get a flu vaccine. If you haven't gotten the flu vaccine, it's not too late at all, because we're just starting to see the rise. In a few weeks in January, my prediction is that there's going to be a confluence, a joining of Omicron and flu together in the population. And I don't know what's going to happen. You can just imagine having a dual virus infection, two at the same time, is not going to be a good thing. So
Right.
two is not better than one when it comes to
Not in this
viral
case, right?
infection. Okay.
Right.
And then let me just point out here what the message I just said. If you have overlapping signs and symptoms that I showed you, and your COVID test is negative, I recommend getting a test for flu, even if you've been vaccinated for influenza. The main reason, flu is treatable with an oral medication. Write this word down if you can. It's Tamiflu, Tamiflu. Tamiflu is very safe. It's been evaluated for years and years. It's been around for years. It is easy to take. It's about 5 doses. You're done. It shortens the duration of your flu illness, and it lessens the severity. So you don't feel as bad when you get flu, if you do get a positive test. You can take Tamiflu as soon as you get that positive test. So don't wait, by the way. Don't wait over a weekend. For example, if you get symptoms on Friday afternoon, try to run in and get a test as soon as possible. Don't wait. And the reason is that you want to get that Tamiflu or drug on board as quickly as you can to help suppress viral replication, the copying of the virus and spreading in your body. You'll feel a lot better too. Trust me. I did this a few years ago. It works. And you can get infected even if you had the flu vaccine. Okay.
Thank you so much, Dr. Kilgore. And we're getting pushed for our time right now, but I think, Dr. EJ, you have something that you wanted to bring out, and we're going to get to that medical moment, Dr. Wolford. But you raised a couple of things, Dr. Kilgore, in your talk there, and so things are changing so rapidly. So I want to invite Dr. EJ, Dr. Deborah to swing in just for a couple minutes here.
No, I think that idea that we are still managing and navigating viruses that have been around before is really important. We've focused on COVID, but we have to be thoughtful about things like flu, right? This is the season, this is what we would normally expect. And it's something we need to consider. And where we can treat things that are treatable, it's really important. And it decreases the stress on our healthcare system. I think what Dr. Kilgore mentioned, this idea of having, an increase in flu on top of an existing increase in Omicron is something we need to think about and is worrisome from a healthcare system that is already sort of stretched. I know at Hurley and McLaren and locally, some of the guidelines have changed regarding our ability to decide antibody treatment, in part because we've seen some data to suggest that Omicron is only responding to some or one really of our antibody treatments. And that antibody treatment isn't as regularly available as we would like it to be. We've also seen that, Omicron is something like 75% of infections in the US right now. And so all of those things are changing at the same time. We know that our antibody treatments were pretty successful against Delta variant, But as we find out more about Omicron variant and its ability to be treated with our current antibodies, we're learning, and some of those guidelines are changing. And I know at McLaren, for example, and at Hurley, some of those guidelines have changed in terms of ability to offer antibody treatment and who can qualify for it.
Yeah. Dr. Deb.
Now that's perfect.
Okay.
Everything that said is great. And I will tell you, as I think the first like truly known Omicron case in Michigan, I had a very hard time trying to donate blood because I thought, and Dr. Wolfert told us, she said that there have been up to 40 or so mutations detected on the spike protein of the Omicron variant. I thought, since I've, had the luxury of having my, sample sequence and knew that I in fact had Omicron, I thought I want to make sure that I contribute to the solutions. And I wanted to donate, blood so that the monoclonal antibodies that we're using are, current and relevant to the variants that are out there. So, I think it's all good information that we have to take in. And the one thing I'll say is our still best front line is prevention. All of these things are preventable. And I still maintain the masks still work. We just now know that you need a better mask. The mask we had before, you just need to upgrade your mask, and the basic prevention strategies still work.
And wear the mask appropriately, like on your face.
Yeah.
So I got a quick question. Dr. Kilgore, I know this is holiday season and there are lots of questions that we want to ask from your presentation, and time is slipping away today. Can we invite you back to another session?
Oh, absolutely. Yeah, you can call me anytime, email anytime, and you can text me anytime, for sure.
Thank you, because we do need you back. We're going to do just 2 minutes, Dr. Wolfert. We got 2 minutes for this medical moment, and we're going to be out for the day so people can finish enjoying their New Year, their Christmas Eve.
So I am going to do a 2-minute or less medical moment. And here it is. So we're going to talk about some hope again here. And the hope that I want to share in this regard is about a new pill for COVID, right? So we have all of the layers that we have. Dr. EJ mentioned that maybe we're losing the monoclonal antibodies not working as well, but there's some hope on the horizon that pills for COVID will be easy to take. You can take them at home. They will help to decrease the severity of the symptoms. And just like Dr. Kilgore mentioned, we have Tamiflu for flu. Now we may have Paxlovid for COVID. In an upcoming week, I will tell you more about it, but think about I think Dr. EJ mentioned the fact that the virus wants to replicate. It wants to make copies of itself. It makes copies of itself by making proteins. This weekend, we're going to think about protein as turkey, so I used a turkey. But when it makes those proteins, it makes them in a big piece, and it has to cut them into smaller pieces in order for them to be helpful. So that knife that does the cutting is called a protease. And what the medication does is that the medication stops that knife from working. So here's my knife. This is the protease that cuts that large piece into smaller pieces. This is the protease inhibitor that stops it from working. And there we have it. We have a new medication that hopefully will be helpful. Of course, there may be some side effects that we have to talk about. There may be some other drugs you can't use with it, but at least there's hope on the horizon. And it got emergency use authorization on Wednesday, and another one got the emergency use authorization on Thursday, but we'll talk about that another time. Happy holidays.
Yes, we will. Thank you. And I see Dr. EJ getting all excited, and Dr. Kilgore, some of the things that you share with us about what's on the horizon and what we need to know about these variants. We look forward to having you come back. So we appreciate you spending this time with us today. Our great panel here, Dr. Deborah, Dr. Lawrence, and Dr. EJ, Jim Malinowski, Dr. Wolfert. Thank you so much for spending this Christmas Eve with us and those that are listening. I want you to remember, those of you that are looking for social work credits, this session will provide those for you today. So please register for those social work credits today because they are available to you. Community health workers, I see some of you on the line today. Yes, you can apply for your continuing education units as well. And we just want you to know, next week, this committed group will be back here to talk to you and give you some more insights about what's going on. But we welcome your questions. So please like us on Facebook and send those questions in. Join us on our YouTube channel at Healthy Flint. Send us those questions in at info@hfrcc.org or give us a call at 810-835-2130. We want to see you next week. For those of you that don't join us, we'll have an open mic session because we want to hear from those of you and your experience through this holiday week as we round out the year 2021. So again, thank you all for joining us. We appreciate you and we'll look forward to seeing you next week for the Flint Community Webinar on coronavirus. Thank you.